there was so much COVID around that people were getting it and, sort of, and almost, and like dying of it in roughly equal amounts. Because here in Fulton County, there's a roughly equal number of whites and blacks. Whites make up about 40, something like 44% of the population, and blacks make up about 42%, so roughly equal. We have been seeing, luckily, deaths and cases are falling for everyone, but much faster in whites. And as of this moment, 88% of the deaths in Fulton County are among blacks. So we've gone from 50-50 roughly to now 88% are among African Americans. And I think that we can ascribe that to the fact that African Americans are not getting vaccinated to the extent that whites are. And it's showing up now in the data.
As faith leaders, we are called upon to deliver the word, and we have the opportunity to share information to protect the health of our congregation.
I think the number one thing that we need is education. And I'm talking about from all views concerning COVID-19, concerning vaccination, that I'm finding more people you take for granted that they know. Either we know or we don't know. Those of us who know, it's our duty to share this information with those who don't know. So there's a responsibility when you have knowledge, and that responsibility is to share it.
We would like to get to, about anywhere from like 75 to 85% of the population vaccinated, because at that point, then, science and epidemiology tells us that, it's basically the pandemic is likely to die out on its own because there are not enough susceptible people for the virus to infect and replicate and then go on to infect other people. It's a relatively simple concept, is that the vaccine needs a vulnerable host in order to survive. If it doesn't find a vulnerable host, it dies. Poof, it goes away. A vaccine is what makes you invulnerable to COVID. So if you can vaccinate a majority of the population, then you have taken away the virus's chance to replicate, to go on and to harm.
We have to acknowledge that there have been some abuses to minority communities in our country. But what we should also recognize is that the work that's been done on this vaccine has been done by a little bit of everybody. One of the leading scientists at NIH who helped to develop the Moderna vaccine is a Black woman who led this charge. And so it's not something that we should let stop us from protecting ourselves and our families.
And it's certainly great to see faith leaders coming together, because those are people, you all are the people that people trust. And so they need to hear the message from you all that they need to be vaccinated. I thought about my childhood growing up. There used to be chicken pox and mumps and measles all the time, but we do not see those things anymore, and that is due to vaccinations. So it's very important that we get this right.
There are still people living in the past, and we have to bring them up with current technology current knowledge in the medical field that has improved man's condition. Things we couldn't do yesterday, we can do today.
What I point out to people is the vaccines in themselves actually are not, they're not new. They didn't spring out of nowhere. Scientists have been looking at mRNA vaccines for easily the last 10 to 15 years. And in fact, some of you might remember that, several years ago, we had other diseases that are also coronavirus diseases called SARS and MERS. I think people might remember, particularly SARS. Now, through the grace of God, those did not go on to become a pandemic. However, scientists developed a vaccine against those, okay? But we didn't need to deploy it because they did not turn into a pandemic. However, the technology was there. So when this novel coronavirus came up, COVID-19 came, it was like the whole research community was all ready to go. And mRNA vaccines are, I'm not going to get wonky about this, but mRNA vaccines are relatively easy to construct and to manufacture, relatively easy. And so they were ready, they were geared to go, and they were able to do this because of the 15 years of research that had gone into beforehand. And when it comes to the testing, nothing was skipped. One thing that the previous administration did do right was that they threw money in the billions of dollars at this so that all of the requisite testing, the initial safety tests, testing and the larger safety trials, then on to what we call the efficacy trials, that they threw so much money at it that the companies were able to conduct them all simultaneously and fully, enrolling tens of thousands of people. And so nothing was skipped in terms of the usual process. It was just faster because the money was there. Normally in the research world, we didn't have anywhere near that amount of money. And so what I emphasize to people is, one, this is not, the technology didn't just arise from one day to the next. Researchers have been working on it for 10 to 15 years, and that the testing skipped absolutely nothing.
And so what we would say to that is that, yes, there are some side effects that you may feel a little tired. You may have a headache. But when we compare the side effects that you have from the vaccine for a couple of days versus the effect of when you contract the virus and potentially have lingering effects from the virus for months later, there really isn't any comparison. So there has been this concern about sterilization, that if I get the vaccine, then I won't be able to have children. And that's just not true. That they're going to put a microchip in us to follow us. That's not true. And this concern that showing up for vaccination, that there's a concern about needing documentation to prove that I'm a citizen if I go to get the vaccine, and you should not be required to show any type of citizenship papers.
There's people talking about these are ways of, the vaccines are there to kill African Americans. And so I basically made the point that these vaccines are there to kill, to protect you from the COVID virus. It is the COVID virus that is killing African Americans, and it is the vaccine that is preventing that. So whoever has that belief has it exactly backwards. The vaccines are protecting us. They're not killing us.